Hi, good afternoon, everyone. Welcome to our webinar. This is Dr. Adeshina from Smash USMLE Review. Um, I want to thank everybody for coming to our webinar today, and I'm very excited to share with you some important information regarding how to study for the USMLE exam. If you're already live on our webinar, you can just say hello. If you have any questions, please feel free to leave your messages, and we can talk more about your questions at the end of the presentation. So today, what we have today for you is basically we shall be talking about first aid for the USMLE Step 1 textbook and how to use question banks to study for the board exam. So the USMLE is a very important exam for you guys, and let me tell you about myself before I start. My name is Dr. Adeshina. I did get my bachelor's in Bloomfield College, double major in biochemistry and biology. I graduated in 2008, got my medical degree at UMDNJ SOM in 2012. I did serve on the Board of Admissions and completed Step 1, Step 2, Complex Level 1, 2, and 3. I was inducted into the Gold Honor Humanism Society in 2011. And I've authored multiple articles on Medscape, did publish multiple case reports. I'm also part of the Dean of Education on Diverse Medicine to Mentoring Program for medical students. And I'm the Clinical Content Director for SmashUSMLE.com. I did finish my emergency medicine residency at St. Luke's Hospital in Pennsylvania, and I'm a board certified emergency physician, and I work in Texas, Memorial Hermann Hospital and Methodist. So without further ado, let's start the presentation. So we shall be giving a special giveaway today. So make sure you wait to the end of the presentation so you can take advantage of this opportunity. So everybody knows the USMLE is a very important exam, and most students often use first aid for the USMLE Step 1 textbook, and they use one type of question bank or multiple question banks, and they often even sign up for a review course to study for the USMLE, and some people like to also incorporate study partners. So what exactly is the first aid? Well, I'm sure you guys are all familiar with the book itself, and let's kind of talk about some misconception about the book. So first aid is known as the Bible of Step 1, and first aid is also a textbook for the Step 1. And a lot of people always equate, like if I memorize first aid, that automatically means success on the USMLE. But let's be honest here. The fact of the matter is, if you ask yourself this question, how much medical knowledge will I have if first aid were the only medical textbook I have to know to be a doctor? Well, I should probably can figure that out, that first aid would not be the only book anyone needs to memorize to become a great doctor. It's only testing all the critical important facts and information that is tested in the USMLE. Now, a lot of students get shocked when they buy the book, right? You know, if you pick up Goyen or you pick up Robbins or you pick up any medical textbook, right? It's very succinct. The information is more detailed. You can read the book and you can understand. Unfortunately, when you pick up first aid, you get disappointed. You wonder why the book has just facts in it. But you know that every fact in that book, as a matter of fact, is very important. The reason is because first aid, as the name implies, if you think about first aid, like you're getting a first aid kit just has the little minimal things you need to be able to get things done. Same thing applies to first aid for the USMLE. It's a collection of important information at hand. Now, that collection just means the authors of the book have actually been able to gather information from thousands and thousands of students who study for the exam and be able to collate the data on important facts that are commonly tested on the board exam, which means when you study medical school, you're learning 100% of this information, but the board might only test you on 50% of the information, and you only care about the 50% that shows up on the board exam. Now, remember, first aid cannot replace your critical thinking and fundamental understanding of basic science. You still have to be able to understand fully this clinical content, right? If you pick up first aid and try to read it, it makes absolutely no sense. So a lot of students that try to pick up the book and read right away find out this is an epic failure tactic because you can't understand what you're reading except you've already had a solid background in medical science. Here's another caveat. If you're going to buy the book right at the beginning of medical school or buy in your second year of medical school. If you're an international medical graduate, buy the book immediately when you want to start studying for the boards. Don't buy the book 2 months prior to your board exam and give it a read. It's not going to work. So that's one important point I want to kind of emphasize. Now, like I said, ideally you want to have the first day of medical school. Now, once you get your first aid, what I want you to do is take the book and take it to Kinko's, Staples, and have them actually cut the book pages. And they'll cut off the binder, and then they place in a 3-hole punch binder. Now, you want to have tabs also, because a lot of students don't understand, like when you have flipping through the book, you want to place tabs at the edges of the book. So by, if you're in behavioral science, you put a behavioral science tab. If you're on biochemistry or if you're in cardiology or endocrine, you want to have those tabs because it just makes it easy for you to be able to flip the book pages as you're actually studying, and you kind of get used to it. Now, when it comes to actually using the book, you have to do this backwards, all right? So before I can talk about annotation, let's talk about question bank, okay? We're going to come back to annotation in a minute, but let's take a look at, this is what a first aid looks like in a binder, okay? You put in a 3-hole puncher, and you kind of see that it's easier for you to open the book, and also it's easier for you to write notes in the side of the book. Now, when it comes to boards, it's slightly different from the way you normally study in medical school. In medical school, they give you 20, 30 chapters, you read through the textbook, you maybe do some practice questions, and then you take the exam, and then you do extremely well, right? That's typically standard medical school. You get a 90, you get excited. The approach for boards is different. You're going to do it backwards. The reason is because, as you can see, the first aid textbook just gives a bunch of facts. How are you going to make sense of all the facts in the textbook, which is first aid? It's by using a question bank. The most trusted question banks out there today, Smash USMLE, UWorld, Kaplan, and there's a whole set of other Q banks out there. Now, regardless of which Q bank you choose, you should start solving the questions way ahead of the exam. When you're still learning the basic science in class, it helps solidify the content. For example, when you start the question bank, okay, you're going to find out very quickly how much you do not know. Because a lot of students think they know a lot. Like they say, oh, let me read first aid and I'll go do a question bank. Wrong approach. It's not going to work for boards. You have to start doing the question bank first. And after you're done going through the question bank, then you can kind of pick up the book and start reading. So today, the purpose of this lecture or this presentation is to show you the strategies when using a question bank. Okay, so how do we use question banks? Well, question banks are actually learning tools and then assessment tools, right? There's so much information on the boards and you don't know how we're going to test you on it. And the board is all integrated. That's really what makes it challenging for students, right? Well, if you're learning biochemistry, you're learning genetics, right? We are probably going to test you on it in a different form or shape, right? We can give you a neurology question, and at the end of the question, it might be actually a genetics answer. That is where students get confused, because it's all integrated form of learning. We're trying to test you everything you've learned from the molecular level up onto the organ system level, which is pathology, and then pharmacology and micro. And this is what makes the exam really challenging. So question bank is really what's going to bring this out and show you how we're going to test you. Now, when you use question banks, and before we actually move on to the next point, I am going to show you a demo of our Q bank of how things work, okay? So here, we're going to go through some selected questions we've picked out for you today, so you get a great idea. So when I actually approach using a question bank, I use the same format every single time. The reason is because you're training for a marathon, okay? And you want to make sure that you use the same style, the same format every time. Even when it comes to the exam itself, you're going to be using the same thing, because if you don't get used to a form of actually studying the same way, on the real exam, you can have anxiety, you might freak out, and they kind of deviate from what you normally do. So on the USMLE, this is exact form of the USMLE. When you actually take your exam, the day of the test, this is what the USMLE looks like. So there's no surprises. At Smash USMLE, we've worked very hard to build a platform that mimics the exam conditions. So we're going to do 4 different questions, and I'm going to show you how I go through the questions. So here we have an 80-year-old male with lethargy, anorexia for 3 days duration. So what I'm going to do is what I typically first do before I start any questions, I glance at the answers. Now, if you look at these options, I picked this on purpose because you can see the answers are very, very long, right? So me quickly glancing into this, I see digoxin here, and I see a little bit of sodium, potassium channel. So before even I start reading the question, my mind zoomed into either cardiology or pharmacology. There's a reason for that. The exam is mixed. So when you're actually taking the exam on the day of the exam, your first question might be endocrine. The next question might be neurology. The next one might be even pathology. The next one might be pharmacology. So your brain is constantly switching back and forth through the whole entire 8 hours, juggling through all the information you have mastered in the course of studying for the USMLE. So in order to kind of break down that barrier and take out the guesswork, every single question that you open or practice, take 1 second. I'm telling you, it takes you, after a while, it takes you 2 seconds actually to quickly process the information. Your brain will recognize the options. Now, in this case, we're looking at potentially a cardiology question or maybe a pharmacology question, okay? Because they're talking about digoxin. Well, now, what I do next is I read the last line, okay? That's always what I do next. So I try to say, in the setting of hyperkalemia, which of the following is true? Now, believe it or not, on the board exam, there are questions that are this long, and what you're going to find out is all you need is to read the last question. And if you read it, you don't even have to read the entire paragraph. So the USMLE used that as a tactic to make you go into fatigue mode, the board writers, because they give you all these cases. And if you look at this question, it just tells you in what setting is hyperkalemia, in the setting of hyperkalemia, which of the following is true? Now, granted, I have not even read the question, but if you look at the answers, we're talking about hyperkalemia because they're saying plasma digoxin level will be higher than expected because potassium and digoxin compete for the same target in the membrane-bound calcium channel. Now, in this question, you can immediately deduce that I don't even have to read the entire question. But just for the purpose of just to show you how easy these taxes are, let's read the question as a whole. Let's start from the beginning. So what I do is I start highlighting. There's a highlight function on the board exam. Please utilize and use it. It's going to save you a lot of headache. So especially for long paragraphs, even if it's not. So they say it's an 80-year-old male, always presents with lethargy and anorexia for 3 days. He has a history of atrial fibrillation and has been rate controlled for several years with digoxin. His history is otherwise unremarkable, and his physical exam was within normal limits. After labs are drawn, he is found to have a plasma potassium of 6 and a dig level of 4. Normal therapeutic levels between 0.8 and 2. In the setting of hyperkalemia, which of the following is true? Now, I want to show you something. See how I highlighted the most important facts inside this paragraph? I can summarize now this entire paragraph in 2 words. 80-year-old guy, lethargic, anorexia in 3 days, AFib on digoxin, hyperkalemia, and dig levels elevated. That's it. Now, what I've done is I've taken out all the clutter because I basically focus on what's really important. And the ultimate question says, in the setting of hyperkalemia, which of the following is true? Now, the correct answer is plasma digoxin level will be higher than expected because potassium and dig competes for the same target, and that's sodium ATPase pump. Now, the next target I always use is, let's assume you didn't know the answer to the question. Then use the right-click button, because then you can take out the guesswork and say, okay, this looks like this is wrong, and this like this is wrong. I'm between B and C, okay, or between B and D. But in this case, the answer would be B. And we give you all the explanation, right? This patient, basically, the correct answer is B. And remember, the way digoxin works, dig actually binds that sodium potassium ATPase protein. Remember that pumps sodium outside of the cell, brings potassium back into the cell, okay? Now, that in turn increases the intracellular concentration of sodium, but it's going to decrease the activity of that calcium-sodium exchanger that you learn in cardiology, and that will lead to increased intracellular calcium. That's how patients develop stone heart and increased inotropic effect of the myocardium, okay? But the problem when there's hyperkalemia, elevated potassium, in the setting of acute renal failure, for example, that potassium is going to compete with digoxin, right? And extracellularly, it's going to increase the level of dig. This is how patients develop digoxin toxicity. Now, this is a great strategy. And what I do is, so when you actually practicing questions, you read this correct answer, and then you read all the incorrect answers, and then you look at your educational objective. And we always have references here. Let's say we didn't give you the normal plasma potassium level. You can search here. You can search for potassium, and that's it. Potassium level is 3 to 5, so 6 is elevated. Now, this is one strategy that I use every single time I do my board question. Now, let's look at another example. We're going to look at question number 3. Question number 3 is similar to question number 1. Now, what did I say? Start by glancing through the answers first. I see vitamin B6. I see isoniazid. I think they might be testing me on TB, maybe micro, but it sounds like something with isoniazid and vitamin B6. But hey, why don't we let's read the last question. At this point, you realize you forgot to supplement his drug regimen with which of the following. Well, that doesn't tell me much. See, in this case, that reading the last option doesn't always give away the answer. So then I progress to reading the beginning of the question. Now I realize my brain has already zoomed in. I'm thinking biochemistry, some underlying pharmacology at this point. So I'm not thinking of any guess. I take the guesswork out of the game. A lot of students want to read from the beginning, go all the way down, and then read the options and then pick the answer. The problem with that is you keep yourself guessing and try to figure out what they're asking you when you can knock that out of the park. So we've got a 67-year-old male. We're going to use the highlight button. Came in with hemoptysis and cough for 3 months. Great. I'm thinking TB right there. Night sweats and no weight loss. I'm like, okay, TB sounds like it. Is afebrile with an unremarkable physical exam. Now, chest x-ray shows some 3 cavitary lesion in the left upper lung lobe. Excellent. Okay. And he's on regimen for isoniazid, rifampin, pyrazinamide, and ethambutol, right therapy. After several months of treatment with his pulmonary symptoms have decreased, his pulmonary symptoms have decreased, but the patient states that he has new tingling sensation in hands and feet. He does not have any diabetes, so they're taking out the point of peripheral neuropathy from diabetes. And at this point, you realize you forgot to supplement the patient's drug regimen, which of the following. I always highlight the last question because now see what I've done again. The same thing. Let's look at the options. Iron sulfate because rifampin can cause pernicious anemia. Okay. Vitamin B6 because isoniazid depletes vitamin B6 in the body, or vitamin B12 because isoniazid decreases its production, and vitamin D because isoniazid may decrease its production in the kidney, and folate because rifampin may inhibit absorption. Now, let's go back to the question real quick. Look at what I've done. I've summarized this entire 5 paragraphs into 67-year-old coming with hemoptysis cough for 3 months, has night sweats, no weight loss, has a 3 cavitary lesion in the left upper lung, is on RIPE therapy, he's got some new tingling sensation in hands and feet, is not diabetic. Look at how easy that is, guys. That is my approach every single time I study for the boards. Every time I do questions, this is how you should approach it. Now, you should be thinking, well, if a patient is on isoniazid, rifampin, pyrazinamide, and ethambutol, remember, isoniazid causes vitamin B6 deficiency. So that's a classic board question. So it makes correct answer to be B. Now, what happened to this patient is that he's developing peripheral neuropathy because he has vitamin B6 deficiency. And we've given you all the explanations here. And what really exact happens in that mechanism is INH induces vitamin B6 deficiency. And what I actually do is I also highlight when I read the correct explanation. What happens is INH binds to pyridoxal 5-phosphate and forms INH pyridoxal hydrosomes. That combination, basically pyridoxal 5-phosphate is a cofactor of glutamic acid decarboxylase, and then GABA transaminase in the GABA sympathetic pathway. And INH overdose eventually you decrease that level of pyridoxal 5-phosphate and decrease GABA synthesis. If you decrease GABA synthesis, that means you basically increase cerebral excitabilities and seizure. And so eventually, anytime you place a patient on isoniazid, you have to give them vitamin B6 so they don't develop peripheral neuropathy. I also strongly recommend you have to read every explanation here, okay? Iron deficiency only causes iron deficiency anemia, not pernicious anemia. And then you go through your education objectives, okay? So let's pick another question. We got a 30-year-old, so remember, glance through the option. So we got aortic dissection, pancreatitis, pericarditis, sounds something like between pulmonary or possible also cardiovascular question. But it's a short question, so this is easy. So we've got a 30-year-old woman, okay, and as you see, what's the most likely diagnosis? That doesn't give us away. So let's start again. 30-year-old woman presented with chest pain for 1 day. Pain is in the center of her chest and works with inspiration and coughing. She reports that it improves when she leans forward while sitting at the exam table. EKG shows diffuse ST elevation in all leads. What's the most likely diagnosis? Now, this is a very easy question, right? Classic pericarditis, right? Chest pain gets better with leaning forward, gets worse when you lean back, right? Now, that is, and it has ST elevation in all leads. It's not on like two consecutive leads, concurrent leads. It's actually all leads. So that gives us pericarditis, right? Remember, if you don't know the answer, you can also always take out the guesser. Aortic dissection, MI, where it's not going to be MI because it's in all leads. PE, no, that's usually a sign of tachycardia. You get an R wave in V1, and pancreatitis will not cause you to have ST elevations. Aortic dissection can cause ST elevations, but if it's an LAD, it's going to affect your lateral leads. So that's not going to be correct. And the correct answer is going to be pericarditis. And you can see here, we give you great explanation. You can see the EKG. Patient has ST elevation in 1, 2, also in AVL. They have in V1, V2, V3, all the way to V6. They also get a PR depression, which is very common with pericarditis. All right. So this is how you go about it. Now, when you actually now start studying for the board, you know, you've answered your question, and let's pick the last, and we'll go over this one more time. Here's another question. You can glance through the options, kind of the same concepts, you know, atherosclerosis, Church-Strauss, sounds like a cardiology question. We got to, you know, you look at the last options. What comorbidities is most likely to associate patient condition? Well, I can't answer the question yet. We got a 55-year-old man come to the ED complaining of chest tearing pain radiating to the back and denies any stroke trauma. I see a wide mediastinum. That suggests the patient is having aortic dissection. Hypertension is most likely cause. Okay, same idea, same concept. Now, here's the caveat, guys. When you actually now start studying, what you do is you go back into your first aid. Now that you know where the answer is, you're going to go back into your first aid that you've already annotated. And what do? Here's your first aid. You find where acute pericarditis is, you highlight. And what I recommend is just pick a highlighter that you love. For example, if you like yellow, and every time you do a Q-band, use your yellow highlighter. Use it to highlight that section. So we just learned about EKG changes with widespread ST segment elevation. See, when you actually try to read this without actually doing a question, you won't realize how important every line is. But now if I highlight EKG changes in yellow, I'm like, oh my goodness, that was a question in the Q-band. I have to know that patient that has pericarditis has widespread ST elevation and or PR depression, okay? At some point, we're gonna test you on patient that have lupus that's gonna present with pericarditis, or patient with rheumatoid arthritis, or patient that's BUN is gonna be elevated, okay? And you're gonna realize that they're also coming with chest pain, okay? BUN of like 100. And then you wonder like, oh my goodness, why are they having chest pain? Well, they have uremic pericarditis, all right? Also, a patient that's gonna have acute ST elevation or Dressler syndrome can develop pericarditis 2 weeks after, you know, having a STEMI, all right? So all a patient that has cancer that we're doing radiation to their chest and inflame their pericardium, now they develop radiation pericarditis. Or a patient that have Coxsackie virus, okay? So you're gonna keep seeing the same concepts over and over with different diseases. But if you look at these diseases, right? If we were talking about Coxsackie, that would be micro, right? Autoimmune like lupus, that would be rheumatology. Uremia, that's nephrology. Cardiovascular, that would be cardio. So, but we're using the same diseases to test one concept. That is when you go through the Q-band, you see all these different topics, and it comes back to the same page, okay? So you have to take notes. Now, when you run out of space of taking your own personal notes from the correct answers, then you go ahead and take a piece of paper, put it inside your first aid, and start taking your own notes, okay? Because you're gonna run out of space, guys. That's just a fact. That is how you use a question bank. And also, this is very important, guys. When you read those incorrect answers, you have to go back to the first aid and find where you found those incorrect answers. And that's very painful, but that's why it takes about 5 hours to get through 44 questions in the QBank. Okay, that's why I said here, start solving the QBank starting MS2 or whenever you start studying as an IMG, and annotate important aspects into your book. Now, and by the end of your board study, look, your first aid should be this big, okay? It's no longer small. You filled it with notes from the beginning till the end. Now that we've learned about QBanks, don't be discouraged if you're scoring below 50% on the QBank, okay? That is not unusual. You are learning. Remember, it's a learning tool. The point of the QBank is to teach you what you don't know and prepare you for the boards. Now, the biggest mistake a lot of students always do is that, hey, plain question solvers without thorough review of answers, I'm just going to get through the QBank. No, you have. The reason why you're using the QBank is because of the comprehensive explanations, not to see how well you're doing on the QBank. Is for you to understand what needs to be tested and what you're learning for the QBank. Okay, so use QBanks, okay, very, very smartly, and solve the questions in random form and in timed mode. Now, at Smash USMLE Review, what we do is we help you basically get through the boards by mashing out the concepts in first aid and also study for the USMLE faster. We help you actually discover all these important clinical pearls that are integrated and also understand how this question bank writers think. And that's going to help save you time about 75% of your time. And you can study anywhere and anywhere you want on the go. The reason why we have that is we have this app that basically allows you to study video lectures inside your app, inside your phone, and basically you can watch any USMLE prep video inside the app. We have a question bank in the app. We have audio books inside the app, flashcards built into the app, and you can download the summary notes from all the lectures. Our questions are about 4,000 questions for the USMLE. We've got 2,200 questions for step 1, and we have about 1,900 for step 2. And we just completed our 1,000 flashcards from Master the Boards. So when you're actually studying for step 2, you can go through our 1,000 flashcards, most tested questions, and you basically use it to review also as you go. So does anyone have any questions at this point? Yes, patients that have TB can also have weight loss. Yes, absolutely. Because Vic is asking questions. Hi, Samantha. Nice to meet you. I don't know if I'm not saying your name right. Blanky Kenowoke, how are you doing today? The QBank. So our QBank currently, I can show you the prices of our question bank. I'm actually gonna open up the polls for you guys to answer the question. Feel free to answer the question. We're gonna give you a special 20% off for today. The offer is only gonna last till today. If you actually click on the website, it takes you to our page. We have different prices for our QBank, and I can show it to you guys so you can see. The QBank starts at $59.99 for 1 month and up to about $180 for 6 months. If you go on our website, I'll give you guys the link here so you can be able to access it. Where do you download the summary notes for each lecture? That's a great question. Okay, so let me kind of run through the website so for you guys to see how our website works. So here's our website. So if you go on our step 1 video section, also, if you go on a step 1 video section, what we did is we broke down our entire website according to first aid. So you start from behavioral sciences all the way to renal. And this is our lecture notes. Okay, this is biochemistry lecture notes. For example, you just click download and the note basically downloads on your computer and you can save it. I think I'm getting a little error here, but might be my internet connection. I think I'm getting blocked by Google, but normally you should be able to, I think it's because of my connection, but you should be able to actually download the lecture notes. Save link as, let me see if I can download the notes. Okay, here it is. So you can download the lecture notes and there you go. You have to download it. I think I'm running into some network issues. But this is where you download our notes, because I think somebody's asking, where do you download all the notes here? Also, for example, let's say you were looking at a lecture, a question in cardiology that I think we talked about pericarditis a minute ago. Here's pericarditis lecture video that you can watch on our website. So we've made videos to follow first aid and all the highlight points you need to know for the boards. So here, for example, if you don't understand pericarditis, even after doing the questions, or you keep getting the questions wrong over and over, here's the video.
Exactly, not just the lungs. If it gets this way, it's going to get to the heart and cause pericarditis. Radiations, right? You're going for chemotherapy.
So as you can see, I've created the lecture. You can see these viruses, acute MI, uremia. We explain all those concepts to you in a very detailed format so that you can understand everything you're learning on our website. That's what makes our company different. We actually focus on using those videos to understand the concepts. So if you go on the video section, you can access all the lecture notes, and you can watch all your videos here. We have animations that explain how the heart functions, and we are basically going through first aid. And rather than try to memorize those facts in first aid, you can basically, you'll be able to watch the lecture videos. It simplifies the concept for you, and then you can take detailed notes, or you can also download the notes for yourself. This is the section where we have our QBank. If you go to the QBank section here, this is where you generate all the question bank. And, we have 2,200 questions, almost 2,234 questions. You can put in tutor mode. You can go in time tutor mode on incorrect or marked. So if whatever section, whatever you prefer, you can pick time or on time. And you can actually subdivide your questions based on which section you want to study. This is pathology. So there's 690 question pathology. And if you just want to study poem or GI, you can actually pick, or you can pick all. You can just click select all and start doing the questions. So nursing is asking how to revise. What do you mean by how to revise, nursing? Jesus is asking, are there only 40 questions per block, right? On our website, you can generate up to 46 questions. So that's the max questions. If I click 46 questions and I click submit, I can generate up to 46 questions. See, all the way to 46 questions here. Okay, so that's how QBank works. On the real test. The real test, yes, it's 40 blocks. The USMLE has changed. Now it's only 40 blocks of questions per block. So it's 280 questions total, yes. Are the notes, videos, audios are just in a slide fashion? No, we have videos. The videos have been transcribed into lecture notes. So you can download them as a summary. So I have 3 days per week. How can you do a study schedule? That's a great question. So if you come to our website here, we have our study schedule actually already created. I'm going to suspend this for a minute. So if you go to our dashboard, on the dashboard, we have our study plan for the USMLE Step 1. You see, we have about 1,300 downloads already. And if you download it, here's our study plan. We actually go through step by step how to study for the USMLE. We have a 3-month study plan. And let me just kind of show you real quick. So we tell you exactly, it's all about review, and then recall. So this is our schedule for a 3-month plan, because I think Jesus is asking a question. So we actually so if you look here, okay, I think you can see better now. Sunday to Saturday. So we actually incorporate UWorld also as a QBank that we recommend in conjunction with our question bank. We have the similar difficulty like UWorld. So because we know a lot of students are going to end up using UWorld also, so you end up having about 4,000 questions to be able to practice with. So what I would recommend for you is that basically you plot out your schedule. Here we recommend micro, and the micro with farm. Okay, and we would put the first aid page numbers here for you so you can follow the page numbers accordingly. This is from First Aid 2015, so we have to update the pages numbers. That will be coming up soon. But what I recommend is basically pick the 3 days out of the week you have off and basically plug in your hours and basically do it block by block. Another thing I would recommend is if you go to our USMLE Advisor section, you can put in your calendar. So when you're studying for the boards, here's the block that we recommend. So we recommend a 3-block schedule. It depends how many hours you have, but this is what we recommend for hardcore gunners. 8 to 12 o'clock, you want to study for 4 hours, but you only study for 45 minutes at a time. Also, you take a break from 12 to 1, and then you study from 1 to 5. You also can take a break from 5 to 6 and study from 6 to 11. Now, this is a very long schedule, but we recommend you only study for 45 minutes at a time. So if you study for 8 to 8:45, take a 15-minute break, and then do the next block of hours. And basically, you can put in here your schedule. See, you can actually type in your schedule here if you want to do micro from 12 a.m. to 12 p.m. to 3 p.m. And it automatically saves it on our website. So you can always come back and track your schedule for you. So that's what I would recommend. So does any other person have any other questions? Okay. If there's no other questions, the only thing I would like to share with you before we end this webinar today is we would like you to share the word with your friends and colleagues. We here at Smash USMLE, we're dedicated to student success. We really care about you succeeding well in the USMLE, and we work very hard to bring you the best and the most up-to-date information for you to study for the USMLE exam. We do have a special 20% going on for today. You can use if you go to the offer section, you can just see get 20% off. Use the code MEDSTUDENT20 to get the offer. Also, if you also here, we have an ebook on the website, which is $29.95, but you're going to get it for free, even if you sign up for our free trial. This is a book we published on how to study for the USMLE and tips for surviving medical school. If you come to our website, the book is actually here under the USMLE Advisor section. You can read it for free. Also, feel free to share with your friends. And also, we are, like I said, we're giving it to 20% off. Go to smashusmle.com/medstudent, and you should be able to access it. And also, I would like to ask you guys to go to the App Store to please download our app. It's free for you to download, and I would love to hear your feedback and your review on our app also. And that would be great if we kind of give us those feedback, and we love to keep improving our products all the time. We also have a sushi as, and I'm planning to take at the end of September. Is it possible I have 3 days a week work to pay bills? Thank you for your insights. Asus, I recommend you can send me an email to admin@smashusmle.com, and we can kind of talk a little bit more about your schedule and how you plan to study for the boards, if that's okay with you. Okay, so thank you everybody today for coming. We really appreciate you. Our next webinar is going to be in 2 weeks. And if you have any suggestions of anything you would like us to talk about in our program, we would love to hear your feedback. Thank you guys for coming. You have a wonderful rest of your day. Okay, bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome. And do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.